Governor Rick Scott practically built his political career with his opposition to the Affordable Health Care Act, also known as Obamacare. But since the law was upheld by the Supreme Court, Scott has softened his tone a bit and today even went to Washington, D.C. to meet with an administration official.
We have got to make dramatic change.
Governor Rick Scott and Attorney General Pam Bondi led the fight against the Affordable Care Act, and even after it passed, vowed to contest its boldest provisions, the biggest of which is an expansion of Medicaid. Starting in 2014, you won't have to be quite so poor to qualify for Medicaid, which will open the insurance program up to an estimated 1.2 million previously uninsured Floridians. But Rick Scott says not so fast.
Florida's Agency for Healthcare Administration put out their estimate of what the expansion will cost just for Florida taxpayers, and it's over $26 billion.
After meeting with Kathleen Sebelius, the administration's Secretary of Health and Human Services, Scott still seemed ill-inclined to cooperate with the expansion of Medicaid, even though the first 2 years will be paid entirely by the federal government and 90% after that.
He's overstating the cost. He's not counting the savings.
Democratic Congresswoman Kathy Castor says by refusing the Medicaid expansion money, Scott is essentially turning away billions of dollars, just as he did with the federally funded high-speed rail.
Those monies are gone. Now we have a chance to keep our hard-earned tax dollars in Florida, create jobs, provide coverage to those who don't have it, and that's worth fighting for.
Scott says he wants a safety net for Florida citizens, but opposes an expansion of government he believes will be irreversible.
I want to promise somebody in our state something that eventually the state can't afford. I'm worried about not the next 3 years, but the next 6 years, the next 7 years. I've got to take a long-term outlook in this regard.
Well, Scott wouldn't say what he plans to do exactly about this expansion of Medicaid, except that he will meet again with Secretary Sebelius to discuss the law further.